Hey guys, welcome back. So today in this video we are gonna talk about the anatomy of the liver. When I say anatomy of the liver, I'm just gonna talk about the anatomy of the liver only. I'm not gonna go into the bile ducts or the gallbladder because that's another part, and I think that's quite easy, and I think you guys can do it. It's just that for this liver we have like a lot of like segments, ligaments. Um, yeah, we have a few things to remember, surfaces and all those stuff. That's why I'm doing a video on this. Okay, so let's start with the liver. So liver, just for it's a fun fact. Liver is always 2.5% of your body weight. So liver is basically the largest gland, largest single organ after the skin. Okay, like if the largest organ means in our body, of course it would be the skin, but then when it comes to largest gland, then it would be the liver, because liver produces substance. Okay, and it is always a wedge shaped, as you can see. It's like a wedge shaped, and approximately it would be around 1.5 kg in weight, and like 1.5 liter of blood passes through it in every minute. So you just remember this magic number of 1.5 in weight, as well as the number as the amount of blood that actually passes through it in 1 minute. Okay, and it is covered by peritoneum. Okay, but before after the before peritoneum we have a capsule known as the Gleason's capsule. Glisson, sorry, Glisson apostrophe S, Gleason's capsule. And this is actually a fibrous connective tissue that actually covers the whole surface of the liver. After the capsule only we have peritoneum. So basically we would actually have two covering. But as for the peritoneum, it won't cover one part of the liver that is also known as the bare area. Later I'll show you where is the bare area. Okay. So roughly the functions of the liver is actually for metabolism, for example glycogen and protein synthesis, glycogen storage, secretes bile for the digestion and absorption of fat, detox of drugs as well as toxin, and it is also a hematopoietic organ in a mature fetus, because during fetal life liver is acting as a hematopoietic organ. That is the one that actually produces the red blood cells and all those things. Okay, so the food that you eat is digested in GIT, and the nutrients except fat is brought to liver by portal vein. So when there is a fat, because fat always pass through the lymphatic vessel, so when there is fat in the liver, when you cut open the liver and when you find fat, that means there is a problem in your liver. Okay, so the location, let's talk about the location of the liver. So liver is basically located mainly in the right upper quadrant of the abdomen, and to be specific, it's in the right hypochondrium and the epigastric region, and extends in the left hypochondrium. Okay, as you can see here, right hypochondrium extends into the epigastric region. Epigastric is just under the sternum, and extends into the left hypochondrium, like a bit more. Okay, and it is immediately beneath the right dome of the diaphragm. If you see here, okay, let me type diaphragm. Okay, if you see here, it is immediately right beneath the right dome of the diaphragm. Why we are not talking about the left dome? Because it's very less. The one that is below the left dome is very less. Only the one which is in the below the right dome is actually majority. So that's why we will say it is immediately beneath the right dome of the diaphragm. And it is also protected by the rib cage 7 to 11 on the left. Okay, where is 11, 10, 9, 8, 7. Okay, it is protected by these strips 7 to 11 on the right. Left, no, because it doesn't even reach here. Okay, then since it is right under the diaphragm, so it moves with excretions of diaphragm. That is, when we inhale and exhale, liver also moves as the diaphragm moves. So that's why when we're checking for the Murphy sign, we'll actually ask them to like inhale and stop, inhale and stop on all those. The Murphy sign is actually a thing that we will look out for in a clinical examination to see if there is any inflammation in the gallbladder. Okay, so what we will actually do is that we will actually palpate the liver by instructing the patient to take deep breath in, and which will eventually push the liver down, so it will be easier to palpate. Okay, and then okay, now we will go on and talk about the surfaces of the liver. Okay, um, okay, okay, this is actually the surfaces of the liver. Okay, um, so basically we have two types of surface of the liver. The first one is of course the one that you are facing right now, which is a diaphragmatic surface. It's a convex shape molded to fit. Okay, and this is actually subdivided into other surfaces, for example anterior, superior, right as well as posterior. So this part is actually the anterior, and this part is of course the superior, and this part is actually the right part, because right part is actually we can actually face the right part from this surface, from the diaphragmatic surface, and also the inferior border. Okay, the inferior border. So that is for the diaphragmatic surface. Now the another surface that this is actually the diaphragmatic surface. Okay, the another surface that that we are going to study in the liver is this one. Okay, this one is also known as a visceral surface. The behind part is also known as a visceral surface, and in visceral surface is where we actually find this porta hepatis. Porta hepatis is where we'll actually find this portal vein, hepatic artery as well as a bile duct. Okay, and okay, as for this visceral surface, the one important thing that you need to know in the visceral space is visceral surface is actually this area is also known as the what is this, the bare area. Okay, this is the layer which is covered by Gleason's capsule but not covered by the peritoneum. Okay, this area. Okay, so okay, we have talked about the surfaces and all. Now we will be talking about the ligaments. Okay, one thing that you need to know when it comes to the liver is you need to know the ligaments. Ligament is very important in liver. The first one that we're going to talk about is the falciform ligament of the liver. So this falciform ligament is formed from the union of the right and left coronary ligament. Okay, this is actually the right and left coronary ligament, and this is actually for the falciform ligament. So what is the function of the falciform ligament? The falciform ligament actually divides the liver into right and left lobe. Okay, that is the function of the falciform ligament. Then we will study about the coronary ligament. So as for the coronary ligament, we have both anterior and posterior part. Okay, as you can see, this is the anterior part and this one is actually the posterior part, and this anterior and posterior part will actually combine to form the triangular ligament. Okay, this is the triangular ligament. Same goes for this side. Okay, this is the coronary ligament, the right side of the coronary ligament, and anterior and posterior of the right side of the coronary ligament will actually combine together to form the right triangular ligament. Okay, the another ligament that you need to know is this. This is also known as the hepatocaval ligament, and this hepatocaval ligament is important because this is the way, this part, okay, this part is where the inferior vena cava will actually pass through this hole, and this one is also known as the ligamentum venosum. Okay, this ligamentum venosum is actually a remnant of the part of the fetal circulatory system, also known as a ductus venosus, and this ductus venosus is the one which actually allows placental blood to bypass the liver during development. That is like there would be a fetal shunt from the umbilical vein to the IVC, and which will eventually enter the heart and goes back to the circulation. It will always bypass the liver because the liver is not functional during the fetal life. And then the another one that you need to know is this one, hepatoduodenal ligament, and this hepatoduodenal ligament is the thickened portion of the lesser omentum. And this hepatoduodenal ligament, okay, is it is actually like a sheet encasing like the common bile duct, the hepatic artery proper, as well as the hepatic portal vein. Okay, this is like a sheet, and here is actually where we will actually find the porta hepatis, where we will be having the bile duct, the common bile duct, the hepatic artery proper, as well as the hepatic portal vein. Okay, and the last one is this one, round ligament. Okay, this round ligament is the remnant of the fetal umbilical veins which degenerate into this fibrous tissue after birth. Okay, so it is also known as a ligamentum teres, and in which teres means round. Okay, so that's all for this part of the video, where we have talked about the surfaces as well as the ligaments of the liver. Next, on the next video, we will be talking about the anatomical and functional lobes of the liver. That part of the video is very much important. Okay, thank you guys.